Hello there. If you're watching this, you've likely just heard the words rectal neuroendocrine tumor. And I know that can feel confusing and pretty overwhelming. So we're going to break down exactly what that means in simple terms to help you get a clear picture of your diagnosis and what happens next. So you've just been told you have a rectal neuroendocrine tumor, or a rectal NET for short. Your head might be spinning with a mix of confusion and worry. And look, that is a completely normal and understandable reaction. It's a complicated-sounding name for something you've probably never even heard of before today. All right, let's walk through this together, step by step. The first thing to know is that your situation is actually very common. The vast majority of these little tumors are found completely by chance during a routine colonoscopy. That means most people have zero symptoms leading up to this discovery. Okay, so let's start with the absolute basics. What in the world is a rectal NET? Understanding this is really the first step to feeling a bit more in control of everything. A neuroendocrine tumor, or NET, is just a type of growth that starts in these special cells called neuroendocrine cells. We have them all over our bodies. But here's the most important thing to hear right now about rectal NETs. They are typically very slow-growing. In fact, doctors often call them indolent, which is just a medical term for slow and not very aggressive. You might also hear your doctor use the word carcinoid. It's an old name, coined way back, and it literally means carcinoma-like. That's because, under a microscope, they can sometimes look a little bit like a more serious cancer. But, and this is a big but, their behavior is often much, much less aggressive. And that brings us to a really crucial point. When you hear tumor in the rectum, your mind might immediately jump to colon cancer. But rectal NETs are a different beast altogether. They start from different cells, and as we've said, they usually grow much, much more slowly, especially when they're small. It's a really important distinction to make. So, what does one of these actually look like to a doctor? Well, during a scope, they usually see a smooth, round little bump that looks a lot like a polyp. They often have this distinct yellowish color, and they're found just underneath the inner lining of the rectum. Now we're getting to what is, without a doubt, the single most important factor here. When it comes to rectal NETs, one thing matters more than anything else in figuring out what to do next, and that is its size. By far, the most common scenario is finding a tumor that's less than 1 centimeter. And if that's you, the outlook is fantastic. The risk that it could have spread is incredibly low, and the treatment is usually very simple and effective. Now, if the tumor is somewhere between 1 and 2 centimeters, your doctors are going to want to get a closer look. This usually means an endoscopic ultrasound or maybe a rectal MRI. The whole point is just to get a better idea of how deep it is before deciding on the best way to get it out. Finding a tumor that's bigger than 2 centimeters is much, much less common. Because these have a slightly higher chance of spreading, they typically require a more involved treatment plan. So let's take a look at what those treatments look like for each of these sizes. Okay, so we've established that size is king when it comes to deciding on treatment. So what are the typical paths forward? What can you expect? This table lays it all out pretty clearly. For those small guys under 1 centimeter, a simple removal during the endoscopy is usually all it takes. For the ones between 1 and 2 centimeters, a local excision is the norm. And for those rare tumors over 2 centimeters, a more formal surgery is typically recommended. So let's talk about the most common finding, that little tumor under 1 centimeter. The great news here is that it can often be removed completely, right then and there, during the same colonoscopy where it was found. It's a simple procedure, a lot like removing a standard polyp. For those middle-of-the-road tumors, a surgeon will perform something called a transanal excision. That just means they go through the anus to remove the tumor along with a little bit of healthy tissue all around it. This is just to make absolutely sure they've gotten the whole thing. And for those uncommon, larger tumors over 2 centimeters, a more formal surgery is usually needed. The goal here isn't just to remove the tumor, but also to check the lymph nodes nearby to make sure nothing has spread. All right, so after treatment, what does the future look like? This is where we get to the really, really good news about this condition for the vast majority of people who are diagnosed. Just take a look at this chart. The numbers are incredibly reassuring. For small, localized rectal NETs, which, remember, is the most common situation, the 5-year survival rate is pretty much 100%. And even in those rare cases where it has spread a little, you can see the survival rates are still very good. And that's not just me trying to be optimistic, that's a fact. This is a direct quote from a leading textbook for surgeons, and it confirms it right there in black and white. For these small tumors, the prognosis is excellent. So what about aftercare? Well, you can probably guess. It comes back to size. For many people with small tumors that were completely removed, the official guidelines say that no further checkups or scans are even needed. For larger ones, your doctor will set up a simple follow-up schedule. So, what's your next move? Right now, the most powerful thing you can do is arm yourself with questions for your doctor. Be sure to ask about the exact size of your tumor, what the pathology report said, and what they recommend as the next step specifically for you. Understanding your situation is the absolute key to moving forward with confidence. Thanks so much for watching.